Part A. In this part of the test, you'll hear two different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, thank you for seeing me today. I've been having some issues that I think need addressing, particularly with my Parkinson's and this persistent heartburn. It's been quite bothersome, especially at night. Every night around 11:30, I start feeling this burning sensation that just won't let up for about an hour.
I appreciate you bringing these concerns to me. Let's start with your Parkinson's disease symptoms. How have these been affecting your daily activities?
Well, my balance has been off, and I'm using the walker more now. My postural stability isn't what it used to be, and I'm afraid of falling. The medications help reduce the tremors, which is good, but these balance issues are quite new and a bit frightening.
That sounds challenging. How about your reflux? You mentioned it's particularly troublesome at night.
Yes, it's very consistent, always at the same time each night. I've tried adjusting my meal times and sizes, especially reducing sweets, but it doesn't seem to help much. Omeprazole and ranitidine have been part of my routine, but they're just not doing the job anymore.
Have you noticed any triggers that might be worsening your reflux besides food timings?
Not that I can tell. I follow a fairly consistent routine. Also, last night I experienced something new. My tongue and throat felt swollen. I thought it might be from the reflux.
Swelling could be concerning. It might be a reaction to something. We need to keep an eye on that. You also mentioned using Miralax for constipation. How is that working out for you?
It works, but I'm worried about becoming too dependent on it. I only use it when absolutely necessary, but even then I feel uneasy about it.
It's good to use it cautiously. Regarding your other medications, how often are you using your nasal spray, fluticasone?
I haven't refilled it recently because I haven't felt much need for it. My breathing has been okay, mostly.
Understood. And how are you managing your overall mobility and physical activity?
I'm attending physical therapy, which helps a bit. They've given me some exercises to do at home, which I try to follow regularly.
That's good to hear. Staying active is important, especially for managing Parkinson's symptoms. Now let's review some of your recent clinical measurements and lab results to better understand your current health status.
Please go ahead, doctor.
Your weight has decreased significantly, which is good considering your heart condition, but we need to ensure it's a healthy weight loss. Your blood pressure is fairly controlled at 135/85 mmHg, which is within the target for your age. Your heart rate and respiratory rate are also within normal limits.
I'm glad to hear that at least some things are on track.
Yes, but there are a couple of areas we need to monitor closely. Your latest lab results show your kidney function is slightly reduced, with an eGFR of 55 milliliters per mins for 1.73 meters squared, which is expected at your age, but still requires us to be cautious with medication dosages. Your cholesterol levels are somewhat elevated, and we should discuss dietary strategies to manage this.
I see. Is there anything specific you recommend?
We can discuss that in detail in a bit. Your thyroid-stimulating hormone is a bit high at 5.8 μIU mmol, which suggests your thyroid might be underactive. We might need to adjust your thyroid medication accordingly.
Okay, that makes sense.
Now, based on your concerns and these findings, here's what I suggest. We will need to perform an INR test immediately to check your blood's clotting status, especially important since you've had surgery in the past and are on multiple medications. I recommend transitioning from omeprazole to pantoprazole for your reflux to see if this offers you better relief. This should be taken 30 minutes before meals.
And if the symptoms still don't improve?
If the symptoms persist, we should consider increasing the dose or possibly adding another type of medication to help manage your reflux more effectively. Also, I will schedule a follow-up with a neurologist to evaluate and potentially adjust your Parkinson's medications, given your concerns about balance and mobility.
Thank you, doctor. I appreciate your help in managing all these issues.
It's important to take a comprehensive approach, especially given your complex health needs. We'll keep monitoring closely and adjust as necessary. Let's make sure to schedule your next appointment on your way out today.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been coming here for a while now, and this pain just doesn't seem to get any better. It's been a constant battle, especially in my shoulders and down my spine. It seems like every little movement just triggers more discomfort. Over the years, I've tried everything from chiropractic sessions to physical therapy, but nothing gives long-term relief.
I understand your frustration. It's important that we keep exploring options that could help alleviate your symptoms. You mentioned using various treatments in the past. Can you tell me more about those experiences and how they impacted your pain?
Well, initially, the chiropractic care seemed to help a bit with my spine, especially the lower back. But the relief was always temporary. Physical therapy was similar. I felt a bit better right after the sessions, but the pain would come back soon after. I've been on different pain medications over the years. I remember taking Etodolac for a while, and now there's this other pain medication. I'm just worried about the long-term effects, especially on my liver.
That's a valid concern, especially with your history of using medications like Etodolac, which can indeed impact your liver with long-term use. You also mentioned emergency room visits due to severe pain. What usually happens during those episodes?
Those are the worst. The pain becomes unbearable, almost like a sharp stabbing that doesn't go away. Each time, they usually give me something strong for the pain and sometimes muscle relaxers. It helps at the moment, but I'm here now, still struggling with this daily.
Thank you for sharing that. It's clear the impact this is having on your daily life. You also had an MRI recently on your right shoulder. What did the doctors say about that?
They mentioned degenerative changes in the acromioclavicular joint. I guess it's part of why my shoulder hurts so much. They suggested continuing with physical therapy and maybe trying some topical treatments like capsaicin cream to see if it helps with the surface pain.
Using a topical agent might be a good approach to manage localized pain without the systemic side effects of oral medications. I noticed you've been using a heating pad too. Does that provide any relief?
Yes, it does help a little. It's soothing and tends to ease the pain a bit, especially at night. I try to balance that with some light exercises, like using weights to strengthen my upper body. It's tough, but I'm trying to keep my muscles from getting stiff.
It's great to hear you're taking proactive steps with exercise and heat therapy. Maintaining muscle strength and flexibility can be beneficial in managing chronic pain. Let's go over your recent lab results and see where we stand. Your blood pressure and blood glucose levels are within a reasonable range, though your glucose is on the higher side, which we need to monitor, considering your diabetes.
I've been trying to manage my diabetes with my diet and insulin, but it's a lot to juggle, especially with these pain issues.
Absolutely. It can be quite challenging to manage both conditions. Your lab results show stable kidney and liver function, which is good news, especially given your concerns about medication effects. For your pain management, considering your liver health and previous experiences, tramadol might be an option. It's less likely to cause liver issues compared to NSAIDs and might be effective for your pain type.
I'm willing to try anything that might help at this point.
I'd like us to proceed with a cautious trial of tramadol. Additionally, I recommend continuing with physical therapy as it can provide some relief and improve function over time. We should also reevaluate the effectiveness of the capsaicin cream after 2 months. It's important to keep track of your symptoms during this period.
Sounds like a plan. I appreciate you helping me figure this out.
Of course, let's schedule a follow-up in 2 months. I'd like you to bring a log of your pain levels and any episodes of severe pain, as well as your blood sugar readings. It's crucial that we keep a close eye on both your pain management and diabetes control.
Will do, doctor. Thank you for taking the time to go through all this with me.
You're welcome. I'm here to support you through this. See you in 2 months or sooner if your symptoms worsen.